Good evening to all. I am Dr. Asavari Sawant, Public Health Specialist at IHW Council, and I welcome you all to this exclusive Hypertension Awareness Series, an initiative by Integrated Health and Wellbeing Council, powered by Servier. According to the Indian National Family Health Survey 5 for 2019-2021, it is observed that 21% of women and 24% of men have hypertension. 39% of women and 49% of men in India aged 15 years and over are pre-hypertensive. Men aged 15 and above have a high prevalence of hypertension than women, and 25% of all men and women aged between 40 to 49 also suffer from hypertension. May is the National Health Awareness Month, recognized every year by the Indian government. May is also the May Measure Month, which is the global campaign by the International Society of Hypertension. Partnering up with Servier and joining the May Measure Month, Integrated Health and Wellbeing Council has organized a month-long initiative to raise awareness on this growing burden of hypertension, to make people aware on the different aspects of hypertension. This live session, we will discuss the topic of accelerating action to prevent, detect, and control hypertension, for which we have very eminent panelists here with us. I welcome Dr. Narsingh Verma, who is the professor and head of Department of Physiology at King George Medical University, Lucknow, and Secretary General of Indian Society of Hypertension. Sir, we welcome you to the show. I also welcome Dr. Arun P. Jose, who is the head of Bridge Center for Digital Health, Center for Chronic Disease Control, New Delhi. Sir, welcome to the show. We also welcome Dr. Anurag Arora, who is the consultant physician and cardiologist and director of Tulip Hospital and current secretary of Cardiological Society of India. He would be joining us shortly. We welcome Dr. Adarsh Naren, who is the consultant cardiologist of Vardhmalian Hospital, Dinguri. Sir, we welcome you to the show.
Thank you.
With that, let us get started. So as the topic is to prevent, detect, and control the hypertension, let us start with Dr. Narsingh Verma. Sir, can you please give us a brief background into how grave hypertension and how prevalent this issue is, and what are the primary and secondary hypertension difference? What it is, what does it mean, and how common is that in India? Over to you.
Thank you for organizing this meeting, which is very important, this May Measurement Month, which is celebrated under the auspices of International Society of Hypertension. And your question regarding the prevalence, you have already told some data. But what data we have, that in India, about 40% prevalence is the hypertension. So it is very, very common in comparison to other NCDs. And it is not limited only to one particular age or particular sex or urban and the rural bias. It is prevalent all over the country. Regionally also, it is found all over the India. So we are having this disease very, very common in our country. And in a few studies which have been done by the Indian Society of Hypertension, we have found that even adolescent hypertension, that is hypertension in the age group of adolescent age group, is becoming very common. And 4 to 5% of adolescents, school-going children, are having hypertension. And in relation to other part of the world, India is having younger hypertensives around 10-15 years before in comparison to other part of the world. Regarding the primary and secondary hypertension, as per definition, primary hypertension or essential hypertension term is used when there is no secondary cause is discernible. That is, we are not able to find out a particular cause why the hypertension has developed. Then we label it as primary hypertension, and which is most common type of hypertension. While secondary hypertension do have some causes that may be endocrine cause, may be cardiac cause, may be depending upon other factors, maybe renal cause. So when we are able to find out a cause for hypertension, it is called as secondary hypertension. And while the primary hypertension, where we are not able to find any particular cause, or most 2, 3, 4, 5 causes are there, and most of the time it is genetic. Genetically, these persons are more prone to develop hypertension, and because of certain regions in the genes, they develop hypertension early. So this is the reason. And diagnostically, what happens when we level anybody hypertension, and this level is not easy, because we have to perform the measurement of blood pressure so many times to find out whether a person is having hypertension or not. A single reading is not for diagnosis. Then we go for certain tests to see whether the patient is having any secondary cause or it is primary hypertension.
Thank you so much, sir. There were some very valuable things that you pointed out, because hypertension is such a common thing now. It is such a common lifestyle disorder that so many people suffer in India from hypertension, from younger ages, even into middle and later ages. But it is of two different types. That it is of primary type and secondary type, depending on the cause, if present or not. Not many people are aware about that, because people usually associate hypertension with their lifestyle habits mostly. So it is very good to know that. Also, that you pointed out that single reading is not enough to classify if somebody has hypertension or not, and multiple readings throughout a duration of time is required. So that is also very important to put it out. My next question is on the detection only, to Dr. Adarsh. Sir, can you please help us understand what are the most common methods of detecting hypertension, and how accurate are these measures that we use in day-to-day in identifying individuals with high blood pressure? Over to you. Please, can you unmute yourself?
Yeah, thank you. And yeah, that's a very clinically relevant question, because when a person walks into the doctor's office, there are basically three commonly used methods used for checking if a patient is hypertensive or no. Number one is the very age-old conventional way, where the patient visits the doctor's office and either the doctor or the nurse checks the blood pressure. This is called as the office blood pressure recording. However, there has been a recent emphasis or a recent change in trend on how we go about measuring blood pressure. Number one is the home BP monitoring, and number two is the 24-hour ambulatory BP monitoring. And it has also turned out that the various societies of hypertension across the globe, like the International Society of Hypertension, the ESC that lays out the hypertension guidelines, the ACC, all these have started emphasizing on the home BP recording and the 24-hour ambulatory BP monitoring. Also, various trials like the SPRINT trial, which came out recently, that emphasizes on unattended office BP recording, just to put out this important thing called as the white coat effect. White coat effect is the one where there is a spurious increase in BP when a healthcare worker, that is a doctor or when a nurse, checks the blood pressure. So how this home BP recording and ambulatory BP recordings outscores the conventional office BP recording is, it gives a pattern. Like sir emphasized before, we get not just a single reading, but we get a pattern of readings, and this allows the doctor to understand if the diet, the exercise, and the medicines that the patient is taking has helped in keeping his BP at a healthy level. Also, about the accuracy, which you pointed out, no measurement is foolproof, that we have to accept, but except the intra-arterial BP that goes into the radial artery or into the femoral artery. Even they have something called as the peripheral augmentation effect. But how you can make these fairly accurate is by doing certain precautions when the home BP is being measured. Just before the BP is measured, at home, a person should make sure that he's using a standardized BP measurement device. And before they get on with the BP measurement, half an hour before, they should ensure that there is no coffee intake, chocolate, or any cold drink, or they do not exercise vigorously for at least 30 minutes before the BP is measured. And they should ensure before they go and sit on their chair comfortably to get their BP measured, they should go into their restroom and empty their bladders. And then when they are checking the BP, they should ensure that they are sitting in a comfortable chair with their back supported, feet on the ground, and arms on the side well supported. And the BP machine should be placed on a table at the level of their heart. And then it is generally advisable that the spouse or someone else who is looking after, they do the button pressing so that the person doesn't look at the monitor and gets anxious again. So these are some of the precautions that has to be adopted to ensure that the BP recording is fairly accurate. Thank you.
Thank you so much, Dr. Naren. On the same note, the next question is for Dr. Jose. Sir, as Dr. Naren mentioned that there are multiple different ways. Earlier, the BP measurement in clinics was considered to be the most accurate form, but now there are multiple different ways such as home BP monitoring as well as ambulatory BP monitoring and some more. So how can healthcare providers ensure that blood pressure measurement is standardized overall? Or if there is a special protocol for the standardized measurement of blood pressure, so that the readings are accurate across different settings and across different populations? And what are some of the challenges that you feel that are associated when we try to achieve this goal? Over to you.
Thank you, Atari, and thank you for inviting me to be part of this session. So I think some of the points have already been discussed by Dr. Narsingh and Dr. Adarsh. The different modalities of blood pressure measurements, whether it's out office or out of office, or the ambulatory blood pressure measurements, all have certain specific conditions under which it's usually taken. And whether it's being measured at home or it's being measured at the clinic, I think it's extremely important to take care of the many aspects, that the healthcare provider or even a non-healthcare professional taking the blood pressure of the patient should be aware of. We, 2 years ago, we had done a study on a large data set, which is the NFHS data. And the idea was to try and see how the blood pressure prevalence in the country would vary based on what blood pressure measurement we take. So in the NFHS, they had taken 3 blood pressure measurements. And we tried to do an analysis on whether there would be a difference in the prevalence if we took an average of the first and second, the second or the third, or an average of all 3. And it was very surprising to us to see that there was almost a 63% increase in prevalence of hypertension when the average of the first and second blood pressure reading was taken. And there was an increase in 27% in prevalence when the 63% when only the first measurement was taken, and 27% when the average of the first 2 readings were taken. And we all know that in most clinical settings in India, physicians usually do not have time to take 3 measurements 1 minute apart for their patients. And repeated measurements is actually very important to take. So I think this is where age-old concepts of public health like task shifting or task sharing, where shifting some of these roles to non-healthcare professionals or allied healthcare professionals would be extremely important in getting more accurate measurements. And if that is the case, which is also the case that the government of India has started the universal screening program for hypertension, diabetes, and 3 cancers, it's very important for us to have standardized training for health professionals, whether they're physicians or non-physicians. It's important for capacity building, refresher training, and sensitization of all health professionals of the correct methods of taking blood pressure, the position in which they're seated, the number of measurements they're supposed to take, because as we all know, blood pressure is a highly variable, vital sign, right? It varies with so many things: exercise, emotion, physical activity, smoking, alcohol. There's just so many things that influence what measurement we get. And so I think standardized training, capacity building across the country, and standardized protocols to be followed by all physicians and non-physicians who are collecting blood pressure is very, very important so that we get accurate measures amongst our patients.
Thank you, sir. You pointed out very valuable points with us, that it is very important for role shifting in the entire healthcare system, that it is important for healthcare specialists and allied health specialists to be trained properly into taking proper blood pressure and into correct blood pressure monitoring. On the same note, there are many people who are not able to visit their healthcare providers that frequently, and if they want to have an average reading for extended period of time, say for example an average reading of morning and evening blood pressure record for 1 week or 2 weeks, it is not very practically possible for those people, if they are in old age especially, to visit their healthcare providers every time. So here comes the role of self-monitoring. My next question is to Dr. Narsingh Verma, that sir, what role can self-monitoring of blood pressure play in the early detection of hypertension in your opinion? And how frequently is it advised to monitor your blood pressure to ensure timely detection of hypertension for somebody who already is prone to or is pre-hypertensive? So over to you.
Thank you for asking a very important question. As Dr. Adarsh Narayan already mentioned, that home monitoring is one of the common method to diagnose hypertension. I will suggest not only to pre-hypertensive, not only to those who are not able to attend doctor's clinic. Without home monitoring, we cannot diagnose hypertension, because a single reading in office is not enough to diagnose hypertension. I will suggest that if the reading is not very high and it is borderline or mildly high, then I will suggest my patients to go for home monitoring. So for home, not only for those who are not able to come to clinic, it is for all. And all over the world, home monitoring is one of the commonest method tool to diagnose hypertension. Now, the point is there how the home monitoring should be done. For home monitoring, it is required that a single time patient should come to doctor or any person who knows about measurement of blood pressure, because without knowing the proper methodology of monitoring, the monitoring will be waste. So, just first thing is to select a good monitor, because every monitor cannot detect hypertension, and India is full of monitors. The market is full of monitors. So one should know that how one get a good monitor. And after selecting a monitor, the person should be trained enough to measure the blood pressure, because there are certain points which are very, very important in measurement of blood pressure. And some points, these points are so important that person has to be trained. And it is that the person should measure blood pressure twice, once in the morning and second in the night. And in the morning, after widening the bladder should not be filled, and the person would have not taken any coffee, tea, etc. And after rising in the morning, the person should measure blood pressure, and he should be seated in a chair comfortably, and the legs should not be crossed, and feet should be on the ground, and back should be supported by the chair. These two things are very, very important. Tight cloths must be removed, not have taken tea or any drug, etc. These points should be trained, and after that, the person should take at least 2 readings or 3 readings in the morning, 2 readings in the evening for 7 days. this method of recording is very, very useful. And then these recordings can be WhatsApp to the doctor. The person is not able to come, and these readings should be monitored by the doctor. Then only he can be labeled as hypertensive, because it is a question which is very important for whole life. Patient will have treatment or not treatment. Not only that, those who are already taking drugs, this home monitoring is important for them as well, because once they do this monitoring, then they will be able to tell the doctor, and doctor will be able to change the doses of drugs. In India, it is very important, because what happens during summer days, blood pressure goes down and we have to reduce the doses of drugs or the number of drugs. And during winters, even the 2 and 3 drugs are required. So again, the up titration of drugs to be done. So for up titration, for low titration, for the maintenance and for the compliance purpose, home monitoring is very, very good. And in the last 4 or 5 years, what we have seen, that home monitoring is picking up in India, especially after COVID. Now the persons in their home, they do have monitors, and good quality monitors are coming, and they are doing monitoring themselves. The only thing required is we should make a good video to teach them how blood pressure should be measured. And these videos should not be in English. They should be in Matribhasha Hindi, because that language is known to everybody. So good quality videos are required in Hindi. This thing is lacking. Most of the education to our patient is in English, which is not correct.
Thank you so much, sir. Very important tips you shared with us, that good and correct demonstration for measuring BP correctly is important, not just in English, but in Hindi and also different regional languages, as there are many people who come from different regions in India and would really be supported if the video material is in their regional language. And also that you pointed out that home BP monitoring is being picked up rapidly in India, similarly to home glucose monitoring. But at the same note, Dr. Adarsh has shared that standardization of BP monitoring devices, it is important to use a standardized BP monitoring devices, because that would also affect if the reading is right or not. So, sir, can you please elaborate a little bit on that, Dr. Adarsh, and also explain us if genetics and family history has a role in being hypertensive or not, and how can individuals who have this sort of genetic risk can take steps to prevent this condition? So it is a 3-part question. So let us take it one by one. Over to you, sir, Dr. Adarsh.
Yeah, we'll start with the genetic part, which you said. Genetics and hypertension, they do have a role, definitely, like they do have a relationship, but there are other factors other than genetics. Like let's suppose that if my grandmother, my mother and me all are having hypertension, but we are all consuming high fat and high salt diet, because is it a hereditary thing, or is it the way my grandmother taught my mother how to cook, and my mother taught me how to cook? So those kind of things, they may seem hereditary. However, it's got more to do with the food that is being prepared at home. So it's not purely genetics, but a cultural mix that sets us up to have a disease like hypertension. That said, however, genetics does play an important role in hypertension, because there are prior studies which have estimated that up to 20% of people's likelihood of developing may be related to their genes. But the thing with genetics and hypertension is that the genes, they predispose you to develop hypertension, but sometimes they predispose you in a way that there are other factors, other things that are needed to initiate or activate the condition. For example, in a particular condition called as the salt-sensitive hypertension, people develop hypertension and a robust increase in BP when they consume salt load. However, if a salt-sensitive hypertensive patient does not consume salt load, they do not develop hypertension to the same degree. So there are things that we can do in ourselves, the choices that we take that interact with the genetic predisposition and in turn lead us to develop or not develop or control or not control our hypertension. So what I feel is genetics is an important thing, but it is not an inevitability. And people with genetic predisposition can still have their hypertension under control by the choices they make. Genetics is not it's not destiny, it's only a piece. And how a genetically predisposed person can play a genetically predisposed person should in fact uh, think of getting actively involved with the healthcare worker and try to make a difference. um, uh, and he should want to make a difference. They should not stop smoking, they should not take high salt diet, fatty diet, exercise regularly, at least 20 to 30 minutes in a day, stop taking alcohol. And one more important thing, which our this ISH motto is, get their BPs checked regularly. And if it is high, go and get treated right away. And regarding the standardized BP devices that you said, like for example, the sprint trial that I was quoting some time back. So they used a particular company which is available widely in market, namely the Omron devices. So such devices which are smart certified, they should be adopted in using measuring home BP. This is what I feel. Thank you.
Thank you so much for sharing those tips, sir. Coming on to the lifestyle and dietary, habits to adopt to prevent blood pressure. We will come on to that later during this session. My next question is to Dr. Jose. Sir, in your experience working in the space of digital advancements and also health, what would be your, understanding of latest devices that are into the hypertension space, and how are these promising, are these helping the innovations that are happening in the space of hypertension for early screening, early detection, at home detection, and wearable devices? So what would be your comments on this aspect? Are these helpful? Are these good, going to rise in future? Should these be widely adopted? What would be your comments?
Thank you, Savri. So there are several digital health innovations that can assist with hypertension management today. To start off with, there are the very conventional, very old school SMS systems. So the SMS is actually a very SMS, and now even messaging applications like WhatsApp have been used extensively in trying to improve compliance, in trying to improve self-monitoring rates, and in also providing health education and health promotion material to the patient. So even conventional information technology that has been there since many years are still helpful in managing hypertension and controlling hypertension. In terms of newer advancements, there are several technologies that are patient-facing as well as physician-facing. Patient-facing technologies such as wearable devices. There are several remote monitoring devices that are available now that help physicians monitor their patients from their hospitals while the patient is at home. There are devices that are wearables. There are devices that are IoT devices or Internet of Things devices that continuously transmit blood pressure measurements to the physician sitting at their hospitals or at their homes. Wearables measuring blood pressure, they still have some way to go in terms of its accuracy and in terms of its validity. But however, they are very promising in terms of their prospects in helping in better control of blood pressure and also in sending out alerts to the health professionals when there is an emergency. In terms of physician-facing applications, now there are several artificial intelligence-based and machine learning-based systems in place that can help physicians with management decisions. So the center that I work in, the Center for Chronic Disease Control, has developed an electronic clinical decision support system in collaboration with the All India Institute of Medical Sciences. So what this essentially does is, it's called the Empower Clinical Decision Support System. And what this essentially does is it has approximately 3,500 to 4,000 case studies in its backend. And based on the physicians, on the patient's information, on the patient's history, the patient's clinical findings, lab investigation findings, it provides the physician with the best possible management plan. It provides the physician with drug choices on possible drug interactions, possible adverse events to drugs that the patient should be aware of. So it provides a very personalized form of management plan for that particular patient. So there are electronic clinical decision support systems like these that are available that can help physicians in better control. So above all of that, there is telemedicine. There's the prospect of how telehealth can improve compliance rates, follow-up rates. So we've seen in the time of COVID how most hospitals became inaccessible to patients with hypertension and with diabetes. These started to become as non-essential consultations or non-essential visits. Many of the health practitioners were busy with providing COVID-related care. Many of the hospitals started getting designated as COVID hospitals. And telemedicine actually did provide relief to a lot of chronic condition patients, especially the patients with high blood pressure, because this ensured the possibility that they would be able to continue taking care from their physician. They would be able to titrate their medications. There are systems available through which the blood pressure that is being measured of the patient can be transmitted to the health professional over the telemedicine platform, enabling the physician to understand what the control rates are. The electronic health records in these systems help them understand what the trends in their systolic and diastolic blood pressure have been. So it helps the physician make better decisions and helps the patient get uninterrupted access to the health system. So there are several ways in which digital health will support patients with hypertension, and it is on the rise with the Ayushman Bharat Digital Mission, the eSanjeevani National Teleconsultation Service. There are plenty of options available for the patients to access the healthcare system while they sit at the comfort of their homes.
Thank you so much, sir, for explaining us that aspect of merging medicine with digital technologies that is on the rise due to support of PM. So on the same note, we would want to discuss the prevention of different, these hypertension and associated problems. So what sort of lifestyle and what sort of tips are, you would share with the audience that is watching, which is from mixed backgrounds, both medical and non-medical, to keep themselves very fit and healthy so as to avoid chances of acquiring hypertension at any stage or any age that they are. So let us start from, this is a question directed to all our speakers. Let us start from Dr. Narsingh Verma, sir.
Thank you for asking this very important question, because prevention is the key for success, because treating hypertension can be a lifetime treatment. Prevention is easy, and in beginning, if it is done, then it has a lot of value. So I will suggest that everybody in my country is prone to develop hypertension. Why? Because of race. We are more prone to develop hypertension and other diseases related to the lifestyle. And what has happened in India from last 50, 60 years, we have become more prone to develop NCD. So we have to start from primary prevention. Primary prevention can be started at community level. So we have to be very, very vigilant since very beginning. That is, I will start with pregnant lady, because during the intrauterine life, when the fetus is developing, that is the best time for any prevention. So the diet during the pregnancy, the physical activity during the pregnancy, and also the social environment at the time of pregnancy is very, very important. That will frame everything, and that will also decide whether the fetus will become child and will become a man or woman, will not be hypertensive. And here I would like to advise two things. First thing is regarding the diet. Diet is one thing which is going to decide everything. In last 50 years, the Indian diet has changed a lot. We have to back to our roots. What we were eating 50, 60 years back, that was the correct scientific eating. The science was not developed at that time, but still we found that Mediterranean diet, or the diet which was used by our ancestors, was the best diet. And here I have 6 formulas which had to be spread to everybody. First thing is early dinner. I myself have done a lot of research on that because it is called a circadian rhythm, and I'm having a society for that, that is Indian Society of Chronomedicine. We do research on this, and what we have found that early dinner can change a lot of things. Not only hypertension, to diabetes, to sleep disorders, and to even fatty liver, to even heart failure. So early dinner is most important intervention one can follow to get the primary prevention of hypertension. After early dinner, I will advise to have the short meals for more times rather than a heavy meal of one time. Then third thing is that 85% of our meal should be not having bread and the rice. It should be the salad and the fruits and the drinks, different type of soft drinks, and it should have a lot of curd and fruits. So these things should be more in diet rather than the rice and the bread. So only 15% is allowed for the rice, bread, and non-vegetarian diet. 85% can be salad, fruits, curd, and the vegetables, and the dal. So this 85% of diet should be like this. And last thing is that the one should have at least 4 to 5 serving of fruits and vegetables in a day. So this is enough for diet. A lot of things is talk about the sodium, but I will focus more on potassium, magnesium, and calcium. Sodium is important, but a lot of thrust has been given on sodium, low salt diet, other things. But the importance of potassium, magnesium, and calcium is also very important. So if one has the lot of fruits, then it will have a lot of potassium, lot of magnesium, and calcium as well. So that is about diet. Second thing about physical activity. Physical activity, everybody knows, at least 30 to 45 minutes per day, any time of the day is required. Intense physical activity of 30 to 45 minutes per day. And third thing is sleep. Sleep is very, very important. I will say India has not slept well from last 40, 50 years because of unknown reasons. Those who are doing night duty, it is understandable. But those are not doing night duty, they are not sleeping without any reason. Voluntary sleep curtailment is very, very important. We have to focus on that. Good sleep is required to prevent hypertension. And after that, reducing the stress. This stress is very, very high. What we have found that in adolescent hypertension, we have found that even children who are not fatty, who are not overweight, they are developing hypertension just because of the over-stress situation. The parents are responsible for that. They are stressing their child for career without any reason. At the nursery level, KG level, primary level, career counseling is not that important. So this is one reason India is having more hypertension. We are stressed people. So de-stressing the society is very, very important. So these are a few things which if one do, then definitely it will help and prevent the hypertension.
Thank you so much, Dr. Verma. That was a very all-exhaustive answer, and you pretty much covered all the points that should be pointed out regarding prevention of hypertension. Dr. Adarsh, if you would like to add.
I'll just like to reiterate the theme: measure your blood pressure accurately. Control it if it is high, so that we live longer. So, and any high BP recording should not be ignored. And I think probably there was a recent survey that happened in the United Kingdom, where even people aged more than 20, they have found that at least a significant number, like 20% of people, they had conducted a study of which comprised some 800,000 people, of which almost 6% of people who were more than between 20 to 30 years had hypertension. So I think probably people aged above 30, because of the urbanization that has happened, should get their BPs checked at least once. And people more than 40 should definitely have their blood pressures checked. And I think the theme of this discussion has been getting a standardized BP mission, like what you said also, like previously this glucometer used to exist at all homes. So I think a BP mission can be there, provided the people are not very anxious and they don't keep on doing the BP measurement. So having a BP mission at home is also a good thing. And people more than 30 years should at least get their blood pressures checked at least once. And if it is high, not to ignore it, because hypertension can strike early and the effect can be disastrous. Thank you.
Thank you, Dr. Naren. Dr. Jose, if you would want to add anything on to these before moving on to our next question.
No, I don't have much to add. I think Dr. Narsingh and Dr. Adarsh have covered most of the ground. I think non-pharmacological management, or lifestyle modification, as we call it, is the most difficult form of management, to be very honest. It
On
requires
the
a lot
same
of.
note, sir, I have, sorry for cutting you out. I have a very pertinent question for you on the same note of non-pharmacological management for hypertension. So, sir, as Dr. Verma also portrayed and Dr. Naren also portrayed, that stress is closely linked with hypertension. And this word gets thrown out very loosely, that because of stress, he is suffering from hypertension, he has high blood pressure, this and that. So can you please help us understand what exactly stress causes changes in your body that can lead to having hypertension, and what are some of the most promising non-pharmacological interventions that you might have come across in various studies for controlling hypertension that are seen to be effective? People suggest relaxation techniques, they suggest meditation, and all different sorts of these allied health therapies to counteract their stress, their hypertension. But any of these that you feel are worth pointing out and are really effective and should be incorporated in life, what would you want to add?
So I think Dr. Narsingh and Dr. Adarsh may be better in a better position to answer this question, because Dr. Narsingh is, he is involved with the physiology of blood pressure, but stress does cause increases in blood pressure, whether it's temporary or it's usually not a prolonged rise in blood pressure that lasts for a very long time. But whenever there's a stress, emotional, mental stress, it can activate the sympathetic system in the body, and it can increase the blood pressure levels. In terms of stress management, now this is an area which have very limited scientific evidence, but there is evidence to show that there are various relaxation techniques that work. Yoga has been studied as an effective way to combat stress, and indirectly also reduce blood pressure. But there is a need for more studies and more scientific evidence to be, be sure of that. But definitely, so it's all about the indirect action of all these relaxation techniques that are there on stress, and then from there on the blood pressure. But I would request Dr. Narsingh or Dr. Adarsh to comment on this.
Definitely, sir. I would ask the same question to all our dignitaries present here. Dr. Narsingh, sir, can you please help us understand how, stress is closely linked with hypertension? Why is it is one of the biggest, conventional causes that are associated with hypertension, and why is this generation seem to have high stress associated hypertension, and how is this? Over to you.
Thank you. I think this is most important thing we want to discuss. Why? Because if you compare the prevalence rate of hypertension in Asia, Southeast Asia, the maximum hypertension is found in Pakistan. 54% of Pakistanis are having hypertension. Then comes the India and then the China. In this subcontinent, after India is China, and before India is Pakistan. So you can very well understand why stress is important. At present, what social and political and other situations in Pakistan is prevailing, it is easy to understand why stress becomes important. The people are so much stressed, they don't have money, they don't have anything to eat. Still, they have to spend a lot on military. In my country, what is happening? The newer generation are being stressed by the society, by the parents. Everybody wants to become a doctor, engineer, CA, etc. 50 years back, very few people were aspirant for these things. They were happy, whatever they were having. At present, since very beginning, parents want that their child should be first in the class. But only one can be first in the class. 100 out of 100, 10, 15 cannot be first in class. So that is the biggest problem we are having at our educational system. I will give one example. In medical colleges, 10 years before what was happening, that in my college, every year, 2 to 3 suicides were there. At age of 18, medical student joins the medical college to become a doctor, not to become a patient. But after doing MBBS, MD, DM, if you compare the data, you will find that after MD, 50% of doctors become diabetic and hypertensive. And after a certain age, when they become professor, around 75% of them become diabetic and hypertensive. Why? Because of the peer pressure, because of the stress. Stress, physiologically, stress is important because during stress time, sympathetic drive is more. And we Indians are known for sympathetic drive. Over-sympathetic stimulation increases blood pressure because our vessels become constricted. They are not dilated. And at the endothelial level, the endothelin-1, which is a hormone secreted by the endothelium, becomes more. That causes endothelial dysfunction. And endothelial dysfunction further increases hypertension. So a vicious cycle is formed. Unless we remove stress, hypertension cannot be controlled. That is how stress is important.
Thank you so much, sir, for connecting the this biological mechanism behind stress and hypertension, as you were trying to portray that the newer generation is under a lot of peer pressure, and social comparison could be the biggest reason that they are facing this sort of hypertension and stress in early ages. So some of the non-pharmacological ways by which we can counteract hypertension could be meditation, mindfulness, and focusing more on the self and not so much on social comparison or chasing the American standard of living. they are exposed to all these different fads and all the social trends following on social medias, that could have something to do with it. So as we are very close to the time, let us move on to another very big aspect, which is linking physical activity with hypertension. So how do you see physical activity being helpful or not so helpful with hypertension, so that we can prevent hypertension even from younger ages, as this is the focus of our talk? Sir Narsingh Verma, sir.
Yeah. So before I go for physical activity, one very important aspect I forgot to mention, that is about the social media.
Yes, sir, please.
On average, 4 to 5 hours are being spent by a person on social media. That blue light is affecting us. Blue light makes our neurons to become active. So our neurons are most of the time active. Our youth are busy with social media. Always they are either seeing a mobile, and mobile they are either Twitter or so many other things. So they are wasting their time on social media. And that is preventing their lot of concentration and making the neurons become more active. That is harmful. And it has been found that that is responsible for development of hypertension, diabetes, and other things. Clear-cut relationship. Regarding physical activity has gone down. Even in villages, I have found that I have adopted 4 villages. I have found that almost 40% of them are hypertensive. Why? Because they are not doing physical activity. There is no difference in urban and rural area. Even rural area persons are not doing physical activity because a lot of instruments are available for agriculture work. Hand work or the foot work has gone. No physical activity is required. They have a lot of instruments to perform. So that has reduced the physical activity, but the diet is same or even become more richer. So more calories they are storing and they are not using in physical activity. That is required. If you compare from European countries and American population has shown that they have retarded the growth of hypertension and diabetes. In Europe, diabetes is growing very slowly. Hypertension also very slowly. They have adopted good habits of physical activity. You will find everybody running even in the afternoon. But in my country, the running or physical activity at the levels is very, very difficult. Even in the school colleges, they don't have fields. They don't have a space for physical activity. At my time, when I was in the school, 2 hours of physical activity was must. Now the school colleges are not for physical activity. They are just engaging students for career. Where the career will go, I am unable to understand. So physical activity has gone. It is very, very important. At least 30 to 45 minutes of physical activity per day is required, intense one.
Thank you so much, sir, for highlighting that. On the same note, I believe Dr. Jose would be able to answer how technology would help us in getting more steps in, more physical activity in, and also monitoring very well, so that we are at par and all the records are correct. Because technology won't lie the steps that you have taken. You might lie to your doctor, if you were to portray verbally what sort of physical activity you did. So how are these devices helping with all sorts of lifestyle disorders, whether it may be hypertension, whether it may be obesity, or diabetes, these chronic lifestyle disorders which require lifestyle management? How is technology advancing and helping us in this aspect?
So technology is essentially helping us monitor our physical activity. Although the technology has become cheaper over the years, and it is possible for us to get very inexpensive wearables. There is a lot of advancements happening even in the wearables in terms of monitoring. So we started off with wearables such as the watches, but now it's progressed into much more convenient wearables such as finger rings, right? So you can wear a ring on your finger that would monitor your steps, just like how your watch would wear it. And it's a lot more sensible option because this can be maintained. You don't have to remove it for all purposes, and so it's a lot easier to wear a ring than wear a watch at all times. So the number of devices are increasing. It helps in monitoring the physical activity. It helps you in tracking your. There's a bunch of things that it tracks. It helps you track not just the number of steps. It helps you track your gait. It helps you understand, how much is your, the distance between your feet during each of the steps that you take, how fast you're walking, how slow you're walking. So it monitors your heart rate and your pulse rate. Along with it, it measures your calories. So yes, it does increase awareness. It helps you become more aware of how much of physical activity you've done in a day. Studies have shown that wearables have succeeded in improving physical activity levels, but sustaining them, complying to them is again behavior change. And this is what I was mentioning earlier. All non-pharmacological therapy or all lifestyle modifications require considerable motivation from the patient themselves. And it's essentially behavior change that needs to take place. And even if it is to wear a wearable or to be aware about what your wearable is trying to tell you, all of this requires behavior change. And so it's important for people not just to purchase a device. I can assure you that there are a lot of people who purchase a wearable device and wear it for a month. And after the month, it lies somewhere in the house or in a drawer. You don't really, see it after that. So that's where most wearables end up these days. It's in the drawer of some cupboard in your house.
Getting lost.
Yeah, or it gets lost. So I think it's important for behavior change to be accompanied with your wearable so that you listen to it. And whatever tracking it's doing for you, it really helps you in making that behavior change and keeping you motivated. And there is a lot of gamification also available now, where the entire physical activity is gamified. You get rewards. I've seen how there are even monetary rewards and scratch cards being given to people who can maintain that. There are prizes being given by credit card companies for maintaining your physical activity. So there's a lot of incentivization, gamification of physical activity through technology, which is a good thing. But at the end of the day, the motivation always comes from the patient. All the other incentives are short-lived. And usually it takes the patient to be motivated to carry out any of these technologies.
Thank you so much, sir. With that, we come to the end of this very informative session, wherein we discussed the action to prevent, detect, and control hypertension in India and the different aspects around it. So thank you so much. I would like to thank our eminent dignitaries for joining us, for taking out time from their busy schedule and imparting us with wealth of knowledge and information. I would also like to thank our partner, Servier, for partnering up with us on this very pertinent aspect of creating awareness around hypertension. Thank you so much. I would also like to thank our audience for staying with us till the very end for this live session. Thank you. With that, we sign off, and I hope you are able to incorporate these valuable tips and information shared during this session into your lifestyle and work towards early detection and prevention if you are hypertensive, even if you are not, for a healthier lifestyle. Thank you so much.
Thank you.
Thank you.
Thank you.